Right, thanks, Sam.
You got it.
Well, heart disease is the leading cause of death for men and women in the United States. But some of the symptoms in women can be different, putting them at greater risk of not knowing what to look for. Here to talk about this is Dr. Heather Swales, a cardiologist at the Hospital of Central Connecticut in New Britain. Doctor, welcome.
Hi, thank you.
Thanks for being here. So tell us, this is so important. What are some of the risk factors for heart disease?
So common risk factors include things like high blood pressure, diabetes, high cholesterol, a strong family history of heart disease and a first-degree relative, lack of exercise or an unhealthy diet, and definitely smoking use.
All right, tell us about some of the classic signs of a heart attack and what symptoms should women be paying close attention to more specifically?
Yeah, so for most people, they have a type of chest discomfort, usually in the center of the chest. It may be slightly towards the left side. They might feel it like a pressure, tightness, a squeezing. It can radiate into the jaw, the neck, the arm, or the back. Sometimes it can be associated with sweating or nausea, trouble breathing. But women, interestingly, sometimes they don't even have chest pain. They may have an unbelievable, overwhelming sense of fatigue, or they may have a sensation almost like indigestion, but that it's not really associated with food.
That's what my friend's mom had. She thought she had indigestion. Are women often mindful of these symptoms?
So unfortunately, a lot of women don't realize that heart disease is the #1 killer for women, and so they don't realize they could be at risk for heart disease. And I think because they're so busy and often caring for others, they kind of justify why they're having symptoms, often blaming it on something else like lack of sleep, a lot of stress. And so it's very important for women to recognize if they are having symptoms that seem unusual or different, that they speak with one of their healthcare providers to see if more investigation needs to be done.
All right, if someone has heart disease, can it be reversed or treated?
Yes. So we have incredible treatments, medications, as well as healthy lifestyle that can actually reverse disease or certainly delay progression. A lot of times we can avoid doing interventional procedures such as coronary angiograms and bypass surgery, but it's important to catch it early. I had an example. I have a woman, she loves to dance, and she was at her son's wedding and kept sitting down on getting off the dance floor because she was feeling a little sweatier than usual and having a slight ache in her jaw. And when she mentioned that to her primary care physician, fortunately, and he sent her to me, and we did some testing and found out she had critical disease requiring urgent bypass surgery. But she had been noticing these symptoms actually preceding the wedding, and if she had said something earlier, I think we could have done something with medications to help reverse her disease and avoid the surgery altogether.
Yeah, interesting symptoms. All right, cardiologist Heather Swales, thank you so much for joining us.
Thank you for having me.